to my colleagues who are here to listen to me. Thank you so much. So I start with my topic here for the roadmap to MRCOG. This is a very traditional picture you can find very commonly on the net, and this is something which everyone, whenever a candidate starts to prepare for the MRCOG, this is the thing which comes in the mind, that this is the mandatory pick for everyone, that when should I get the chance to click my pick there. So this is something which everyone dreams of. Some few words about the Royal College of Obstetricians and Gynaecologists. The RCOG is an old college since 1929, and the motto is to let us overcome our difficulties. So the RCOG's aim is to set the standards to improve the women's health and the clinical practice of obstetrics and gynecology in the British Isles and across the world. To set these standards, they have few examinations to give the memberships, like the DRCOG and MRCOG. DRCOG is basically the diploma in the Royal College of Obs and Gynae, and this is for the general practitioners. So DRCOG examination is aimed at doctors who are basically either the general practitioners or they are practicing medicine, maybe as a midwife, or but they have their special interest in the obs and gynae. So they are doing some special work for the women's health. Then comes our own known MRCOG, which everyone knows. This is an exam for the specialty. When you want to specialize in the obs and gynae, that's your only field you are specializing, then this is the membership exam. And this is a 3-part examination. We'll be talking of this exam particularly in the detail. How can you be the member of the RCOG? So there are 3 ways of being a member. Either it's a full membership for the MRCOG, or you can be an associate member, or the fellows or the FRCOG. So we have heard a lot about the MRCOG and the FRCOG. We will be just talking of FRCOG also in bit detail. But for the associate membership, this is not very well known to the people. But yes, this is also a certificate you can get from the RCOG, and who can apply? All of us. Any person who is having the medical degree and working in the field of the women healthcare. So all the obstetricians and gynecologists working can go for the associate membership, and it's really a good news, and happy to know that there is no exam for this. You just have to fill a form, send it, and there is some fees, and you have to send some documents which RCOG will be verifying. Once they come to know that yes, you are actively involved in the field of obs and gynae, you can get this. What is the benefit of getting this? You can have a certificate of the associate membership, which you can very well display in your professional profile or your clinics. And this shows that this gives you a point that you are updated in your field of obstetrics and gynecology. And also you can have access to the all RCOG e-learning resources and their journals. So this is something to start with. You can get it without going for the exams. Now, something about the FRCOG, because there is a concept that after MRCOG only you can get the FRCOG, but no, there are 4 routes for it. Definitely after MRCOG, after 12 years, you can apply for the fellowship. So fellowship actually is a mark of the status of seniority, that you are now in a senior category of the college. So when you have been long associated with the Royal College, and you show that you have continuously been working in the obstetric and gynecology field and doing something for the women's health, then you can opt for the fellowship. But there are other categories also where our seniors can easily opt for the fellowship. Like it is when you have to show that you have contributed significantly to the advancement of the specialty. So it is the fellows addendum, or you demonstrate some exemplary work in the specialty, like the fellows honoris causa, and distinguished people outside the medical profession, like the honorary fellows. And this is something I would like to say. In my convocation ceremony, there was one senior midwife who has worked a lot on the shoulder dystocia. She was given the honorary fellowship. So you can now see that it is not basically your degrees which can give you the fellowship. It It is basically how much you can go into the field and work for the people and the betterment of women's health in obstetric and gynecology field that can even bring you to the honorary fellowship. Now, why MRCOG? When we have to talk of MRCOG, of course, it's a good route to go for the UK. In fact, if you have to go and settle in the UK, then this is the route. You have to go through this. Or if you want to settle abroad, then also this is a gold standard qualification. You have to, you can do this qualification and you can get add-on thing, because most of our degrees are actually not recognized even in the Middle Eastern countries. So MRCOG is one which is recognized everywhere. So that way it helps. But most of the people, when they call me, their first question is, what do you get after MRCOG? If you don't have to go outside, why to do the MRCOG? So the thing is that the important point here is that see the RCOG's vision. What is the roles of the obstetrician and gynecologist? The RCOG sees the obstetrician and gynecologist as an amalgamation of the three things. That person should be a good clinician, good professional, good teacher, and good researcher. So what does that good professional? Because every day when you are into your practice, you have to make judgments of good and bad things for the people. So you have to be very good clinician. We all know this. Then regarding the teacher. So the father of medicine, Hippocrates, has placed in the oath the teaching prior to the clinical career. So same thing is followed by the GMC. GMC has also made involvement in teaching a key principle upon which good practice is based. So same concept is by the RCOG. If you are a good teacher, for being a good teacher, you have to be a good role model. So being a good role model, you are a good clinician and a good person. So your good qualities will be carried by your duties. So being a teacher is another important thing, and being a researcher. Why everyone has to be researcher? I don't want to publish any papers. Why I have to be a researcher? But yes, because when I have to think what is good for my patients, I have to analyze the various studies. And when we have to analyze the studies, how can we know that this is a good study? This is something we should follow or not? So we have to be good on the stats. We should be able to analyze the data, comment, appraise on the clinical studies to tell how we can be a good researcher. So all the three are required if you want to be a good professional. So if RCOG makes you develop all these qualities simultaneously. Now, in how the journey of MRCOG exam goes, we all know it's a three-part exam. It's a part 1, part 2, and part 3. Part 1 and part 2 is
yes. And how do they get from the mailroom to you?
Part 1 and part 2 is a written exam, and it is held in the January and the September. And part 3 exam is the OSCE exam, that is the Objective Structured Clinical Examination. It's an oral clinical exam which is held in July and the November. So steps to MRCOG part 1 exam. How can you start doing that? First, you have to log in to the RCOG homepage, that is this www.rcog.org.uk. When you click on it, this type of a page opens up. There is a sign-in column here. You can go and click it, and then you have to fill your details and you can open your account. Anybody can go and do that. It's absolutely free of cost. You don't have to pay anything to open your account. Then second thing comes is you have to apply for your eligibility application. So for the eligibility, they actually want to know any person who is MBBS can go for MRCOG part 1 exam. So just one thing you have to put in the email is, add in the email is the scanned copy of your medical degree or your registration certificate of the council. You can add that to a filled form which you have to download from the site, and then you can mail it to the RCOG. They will verify your medical degree, and once your degree is verified, then the column of booking the place for the exam opens. Then you can go and check for the dates Whenever the exam is open for booking, you can choose your center and book your exam. And definitely every year, every time, in fact in July and when February it is the exam, then you have two centers in India. So there is no problem of that. Then we come to how the MRCOG Part 1 exam format is. It's a written exam. It considers all the basics and the clinical sciences, whatever subjects we have done in MBBS. So there are two papers, paper 1 and paper 2, both of 2.5 hours duration with 100 questions, which is single best answers. We all know what is single best answers is. There is a stem, there are 5 options, and you have to match and choose one single answer. Usually it's an exam with the written booklet is there, but since this time is a corona epidemic, so now they are doing the computer-based test. So the exam will be conducted at centers, but that will be computer-based. Syllabus incorporates, as I said, understanding cell function with physiology, endocrinology, biochemistry, human structure, which incorporates the anatomy, embryology, and the genetics, measurements and manipulations, which include biophysics, epidemiology, and statistics, data interpretation, and pharmacology, understanding illnesses, so immunology, microbiology, and pathology, and how do you have to carry on in the clinical situations, that becomes the clinical management. So all your MBBS part with some amount of your clinical knowledge also. Then once you pass the Part 1 exam, you get a pass certificate of the Part 1 exam that you can keep it with yourself, but you cannot tag yourself as MRCOG Part 1. Now you have to apply for the MRCOG Part 2. So MRCOG Part 2 again is a written exam. You have 2 papers here. One is for the gynecology and one is for the obstetrics. So it's a 3-hour duration paper with 100 questions each. But in Part 2 exam, there are 2 types of questions. SBS, that is single based answers, and extended matching questions. We all know what SBS are. Now what are EMQs? EMQs, the RCOG has conducted a lot of research, and they have found that EMQ is the best way to see the depth of knowledge with the candidate. Why? In this question, you have around 20 options. There are this much options, but there could be more options also. And then related to these options, you have 2 or 3 scenarios are there in a single question. Okay, so this all, like, even if there is question 3 or 4, this could be a one question. Now you have to relate a correct option to this scenario. The options are so close to each other that the EMQ has a very less chance that any candidate could get a right answer by just making a guess. There is no probability according to the research by the RCOG. So if you have the knowledge, then only you can tick mark the answer here. So this is the main rate limiting step for the Part 2 exam. For this, you have to have a very sound knowledge. The various modules, which include the whole syllabus of the Gynae and Obs, is covered in the MRCOG Part 2 exam. You can see the things here which we study: core surgical skills, post-operative care, maternal medicines. These are the topics we usually do. But the different one is the teaching and research. This is a complete module. And definitely you have to do the clinical skills, which include the soft skills, like the communication skills, mentoring skills, and also your clinical governance topics, which includes part of NHS, how NHS works, and how the clinical governance and the laws are there in the UK. Then once you have done your Part 2 exam, you get again a Part 2 exam certificate, and now the Part 3 window opens up for you. You can go for the Part 3 exam. This is a clinical skill exam which assesses all your whatever theory you have read in the Part 2 exam will be tested in a clinical scenario in the Part 3 exam. Eligibility for the Part 3 exam is that you should have passed the Part 2 exam, and also you need assessment of training. So what is this assessment of training? This is, you have to fill this form. You can download this form from the RCOG website, and you have to fill this and send all the records, whatever work you have done in the field of obstetrics and gynecology. At least minimum 4 years of experience a person should have before applying for the Part 3 exam. And if you have only 4 years of the experience, then your last 2 years of experience should be within your last 4 years. Okay, it's not that in a long back, 10 years back, you did 4 years work in obs and gynae. Now you cannot apply. But if you are in a continuous practice, like most of us are, we are consultants, we have been practicing regularly in the obs and gynae, then that's not an issue for us. And if anybody is opting for only 4 years of the experience, and that 4 years is counting by going to various places, then a place will be counted if you have worked there for at least 6 months. Okay, so this is not the issue with, I think, most of us present here, because we have been working for a long time in this field. How the part 3 exam look like? This is a room with 14 chambers you can see here. Same view you can see when you go to the exam circuit. They call it a circuit. There are 14 chambers where you have to go one after other. There is 10 plus 2. 10 minutes inside the chamber and 2 minutes outside the chamber. 10 minutes again you have to go into the next chamber, 2 minutes outside. 2 minutes outside is, there is a history printed on the door of the chamber. For 2 minutes you can read that history. 10 minutes you have to go inside, talk to patient, or whatever task has been given to do, you have to do that task. Now, how you are assessed? There are 5 things. They want safe doctors. Safety is the priority with the RCOG. So, patient safety carries the highest percentage. Then comes how you communicate with the patients and the relatives, and how you communicate with the colleagues, how you gather the information, and then how you apply your clinical knowledge in whatever management you have to discuss with the patient, or you have to explain the investigations. So these are domains. There are 2 types of tasks. There are simulated patient or colleague tasks. This means that there is a patient sitting. It is like that you are in your clinic seeing a patient. So patient is sitting in front of you. Examiner is like a fly on the wall. He'll just sit on one side and not even speak to you a single word. You have to talk to patient, counsel her, whatever task has been given to you, you have to do that in 10 minutes and you will come out. Examiner will not talk to you, he'll just observe and mark you. In some stations, there can be 2 examiners. So one is a lay examiner. He is just a lay person who will actually see how you communicate with the patient. As a lay person, what nice he sees you as a doctor. How nice clinician you are when you are dealing with the patient. So that in those stations, lay examiner has more marks to give you than the clinical examiner. So now you can see how important it is to communicate with the patient, how good your communication skills should be. Then your structured discussion task, in which you have a consultant in front of you. He has some case or some operative notes or something to discuss with you, as if you are discussing something with your consultant. So this is the way how you go through one after another. You have 3 parts to go through. This is MRCOG exam currency, which means that after how many years you can do what. So once you clear the part 1, within 7 years, you have to apply for the part 2. If next 7 years you don't apply for the part 2, go back to part 1 again. After part 2, you can anytime attempt the part 3. But it should again be in a range of 7 years if you want to go and settle or you want to get registered in the UK register. If you don't want to get registered in the UK register, you are going to stay back in India, then there is no dearth of time. After part 2, anytime you can go for the part 3. Number of attempts, you have 6 attempts to pass the part 1 and the part 2 exam. For the part 3, there are only 4 attempts. If you don't do in 4 attempts, then you will have to go back to part 2, do it again, and then come for the part 3. Once you have been gone on through all this, then you are welcome to the members admission ceremony. And I swear it's really worth going there. When you go there, you feel you were very well doing all the hard work you have done. You will feel so good. What are myths and facts? It is necessary to go to London for experience. No, you can do it from your home country. No need to go anywhere. Very good online resources. As the sir said, we have ICOG courses also for MRCOG part 1 and part 2. So very easily you can prepare staying here. And exam center is part 1, part 2, part 3. All centers are there in our country. So no need to go anywhere. It is very tough. Takes lots of attempts to pass. No, it's not tough. It's smart. You need to understand the pattern and focus your efforts accordingly. Be strategic. You have to strategize, plan, and go do it. You cannot work with the exam preparation? No. No leaves required. I think in all 3 parts, I took a leave of around 10 days. And it's targeted, but you have to be very targeted. You have to strategize yourself, and very important, persistent and consistent in your efforts. Perseverance works because it is not something which you are going to read in last 15 days. It is something which is absorbed into you, that will come into your mind, because all the clinical scenarios you get, it's something not which you are going to cram up. So you can do it with the work. Now, cherry on the top, once you do your MRCOG, submit your certificates, write an application to our esteemed college, ICOG, and you can apply for the MICOG. So simultaneously, you can have both things, MRCOG and MICOG. So it's absolutely win-win situation. And I'm really very thankful to Parag sir. I sent my application, he interviewed, and he forwarded my application for the this MICOG convocation. So I'm very much thankful to him. And this is, I think, the journey would be an amazing one for all of you. And I really thank you for the patience listening. This thank you itself says it's a win-win situation.
Yeah. Thank you, Bhavna, and it was indeed a wonderful presentation.
Thank you.